For the first time in 19 years, the Philippines confirmed a case, and Myanmar had bad news as well. For more, DW had the chance to speak to Myanmar's health minister, Myint Htwe. He was in Berlin this week for the World Health Summit, and I started out by asking him about the work to eradicate polio in his country.
And very recently, in May 22nd, we detected a acute fracture paralysis, the polio child, in one of the states, which is Karen state, We immediately take action because we have been declared a polio-free country, so this is not good for my country, And we immediately detected it because our surveillance system is very good. Immediately report to us, and we examine this, and it is vaccine-derived poliovirus, type 1. And to further confirm it, we sent to Bombay, and they identified there were certain nucleotide changes, genetic pattern changes, and this poliovirus exactly came out from the vaccine. The vaccine that we use are live attenuated. At any point in time, they become active, But even if they become active, if the coverage is high, we do not need to worry about polio. But in that particular area where the child got polio, the coverage is less than 40% of the children polio being vaccinated. Why? Because the people living there, they do not know the value of vaccine, the protective value of vaccine. That is why, although we have, people over there, they are not coming. And the most, I think, important issue is we cannot go there. This is somewhat like an insecure area. Our health staff cannot go inside.
So I want to talk a little bit more about this, the fact that military conflicts complicate your ability to provide public health for people in the country.
Yeah, that is an issue not necessarily for my country, but any countries all over the world. If there is unrest, our health staff cannot go there, Then all the health activities will be down. All the money that we invested will be down the drain. So if we have a very peaceful nation, health status will be dramatically improved, especially to those population living in remote, underserved, hard-to-reach areas. These are the people who are suffering. And on top of that, because of that, the health literacy level of the population living in these areas very low. They do not even know the benefits of vaccination. Eating salt can lead to, hypertension. They do not know. So that is why I want to say one thing, I think we are going to distribute 29,000 tablet phones, 8-inch tablet phone, to all the basic health service workers, midwife, public health assistant 1, public health assistant 2, health assistant, lady health visitors. In these tablet phone, all the SOPs and guidelines issued by the Ministry of Health are inside.
Your mention of the tablets is very interesting, and I really want to pick up on that because essentially you're talking about preventive health. Now, Myanmar doesn't have a universal health care system. People have to pay out of pocket, and essentially there isn't much support. What are you doing? What is your ministry doing to try to improve public health and also try to get people to be better with preventive health?
Generally speaking, our public health care system is very good. We have a very good infrastructure, very good. That is what I would like to say very strongly, I'm quite satisfied with the way we have different strategies to tackle different diseases. We have a different program managers, 43 programs dealing with all the health issues, occurring in my country.
Your country has actually been quite a standout in terms of its ability to combat malaria. What lessons do you think you have to offer to other countries in the region?
Yes, malaria, we are doing very well. We are on the road to malaria elimination very soon because we have many well-trained malaria workers and we work very closely with the private general practitioners. Once they have malaria, they refer the case and we give straight-away treatment. Almost the number of deaths drastically reduced to a few people only, So I'm very much proud of especially malaria, TB, and HIV program going on very well. But, as you know, there are still room for improvement in any program. We are doing all out to further improve the situation, yes.
Minister Myint Htwe, thank you very much.
Thank you, ma'am. Thank you very much, ma'am. Yes.